Hello everyone, I'm Dr. Monica. In today's video, I'm going to talk about host modulation therapy, an important concept in modern dentistry and periodontal treatment. So to understand the host modulation therapy, first we need to understand two important terms, that is host and modulation. So what is a host? So host, it is the organism from which a parasite obtains its nourishment, or in the transplantation of tissue, the individual who receives the graft. So in simple term, host is the person or organism where the disease or infection occurs. Coming to modulation, it is the alteration of function or status of something in response to a stimulus or an altered chemical or physical environment. So in simple term, modulation means changing something so that it works in a better or controlled way. So host modulation, it means modifying or regulating the body's response to disease during the inflammatory response so as to reduce the tissue destruction and so that it can promote tissue healing. So the concept of host modulation was first introduced by Williams and Golub et al. In 1990s. So in periodontal disease, there is interaction between bacteria and the host. So the host modulation therapy, it focuses on the host side, which means that it controls the body's response to the bacteria. HMTs do not switch off normal defense mechanisms or inflammation. That means that HMT, they do not completely stop the body's normal defense system. Instead, what it does is they ameliorate excessive or pathologically elevated inflammatory processes to enhance the opportunities for wound healing and periodontal stability. That is that they control or reduce the excessive inflammation and they help in wound healing. So to understand how the HMT works, we have to first understand the pathogenesis or periodontitis. So during microbial challenge, the bacteria, it releases antigens, lipopolysaccharides and virulence factors. In response, the host releases antibodies and PMNs. So during this, the host also releases inflammatory mediators such as cytokines, prostanoids and MMPs that affect the connective tissue and bone metabolism. So this leads to the breakdown of periodontal tissues and bone, leading to the clinical signs of periodontitis. Also, the genetic risk factors and environmental and acquired risk factors, they affect the host immune inflammatory response and the connective tissue and bone metabolism. The HMTs, they are going to modulate the or they reduce this kind of destruction by treating the aspects of chronic inflammatory response. That is, they help in reducing the excessive levels of cytokines, prostanoids and MMPs. So this diagram, it shows the balance between periodontal health and periodontal disease. On the left side, we can see that for disease to occur, we need the presence of risk factors, overproduction of pro-inflammatory destructive mediators, underactivity or overactivity of aspects of host response, poor plaque control, and subgingival bioburden. And for periodontal health, mainly we need reduced risk factors, production of anti-inflammatory or protective mediators, resolution of inflammation, OHI, SRP, surgery, antiseptics, antibiotics to reduce the bacterial challenge. Here comes the play of host modulatory therapy. So the HMT, it maintains this balance by reducing the harmful inflammatory mediators and by increasing the protective mediators. So it controls the tissue destruction. So this diagram shows the role of HMT as an adjunctive therapeutic agent. So the bacterial component, they will release harmful bacterial products that stimulate the host cells to produce inflammatory mediators such as prostaglandins, cytokines and MMPs. So which leads to the connective tissue breakdown and bone resorption, leading to formation of periodontal pockets and clinical attachment loss and eventually tooth mobility and tooth loss. So the HMTs, they will act on the host response component. For example, the NSAIDs, they will reduce the production of prostaglandin. Peristat, they will inhibit the MMP activity or they will reduce prostaglandin production and inhibit osteoclast, and bisphosphonates, they will inhibit the osteoclast, thereby reducing the bone resorption. So along with the conventional periodontal treatment, HMTs, they reduce the periodontal tissue destruction and improve the periodontal healing. So this diagram, it shows the complementary treatment strategies in periodontitis. So this shows that for successful periodontal treatment, three important approaches, they work together. First one is to reduce the bacterial burden by scaling and root planing, use of antimicrobials, and by performing surgical pocket reduction. Second is by modifying this factor, and third is the use of HMTs as an adjunctive therapy. So few systemically administered host modulation agents include NSAIDs, bisphosphonates, tetracyclines, enamel matrix proteins, growth factors, and bone morphogenetic proteins. So NSAIDs, they basically modulate host inflammatory response by inhibiting the COX pathway and by reducing the prostaglandin production. So this leads in reduction in alveolar bone loss. Also, clinically, it has been found that they reduce gingival inflammation and inflammatory mediators, mainly MMP8, but their long-term use is often seen with slow periodontal bone loss. Also, the low dose of aspirin, they also improve attachment outcomes as when used as an adjunct. So main limitations with its use include the benefits they are lost after discontinuation, that is there is a rebound effect. Also for long term routine use, it is not suitable due to side effects such as GI irritation, bleeding tendencies, also the renal and hepatic risk. So coming to bisphosphonates, they are bone-seeking agents. As an HMT agent, they reduce the alveolar bone loss by inhibiting the osteoclast function. They also interfere with osteoblast metabolism. Also, they affect secretion of lysosomal enzymes and they have anticollagenase properties. So mainly they modulate the host response by reducing the periodontal bone destruction. The main disadvantage include that they may inhibit the bone calcification, they may induce changes in white blood cell counts. Also, there is risk of avascular necrosis of jaws and there is increased risk of bone necrosis after the dental extractions. So, therefore, no bisphosphonate is approved specifically for periodontal disease treatment. So next is tetracyclines. So they act on multiple components of host response. As an HMT agent, they are not used for antibacterial effect. So they are the only clinically approved MMP inhibitors for periodontitis. They reduce the collagenase activity in the GCF and they also inhibit the MMP8 and MMP13. Mainly on the bone, they reduce the ICTP and therefore it reduces the alveolar bone destruction. So the doxycycline, the STD, it is the more effective compared to the tetracycline and minocycline forms. So next is sub-antimicrobial dose doxycycline. So it comes in the dose of 20 milligram doxycycline by the name of Periostat. It's an adjunct to SRP in chronic periodontitis, which is used twice daily for 3 months up to 9 months max. So it is the only systemically administered HMT specifically which is indicated for the chronic periodontitis cases. So modified release, there's a new compound that is Oratia which is used once daily for better compliance. So the reason for use of SDD form of doxycycline is that they downregulate the activity of MMPs, they reduce the cytokine levels, and they stimulate the osteoclastic activity by upregulating the collagen production, and also they help in forming the new bone. So coming to the locally administered HMT agents, we have NSAIDs. In this, the topical NSAIDs, they have shown benefit in the treatment of periodontitis, but they have not been approved as local HMTs for management of periodontitis case. Coming to Emdogain, this is an enamel matrix protein which is approved by FDA for adjunctive use during surgery to assist with clinical attachment gain and wound healing. Next is recombinant human platelet derived growth factor BB. This is also FDA approved, which is used in regenerative procedures. Next is BMP2. It is FDA approved and it is soaked onto an absorbable collagen sponge to assist with ridge and sinus augmentation. If you have found the video useful, please like, share and subscribe to this channel. Thank you.